1 minute,
Sir,
doctor.
doctor, please wait. They will be inviting you very shortly. Okay, please wait for 2 minutes. Yeah, Johnson, please proceed.
Yes, sir. Good morning, everyone. Our distinguished speaker, respected principal, director, delegates, and my dear colleagues and students. Lourde College of Nursing proudly presents another webinar on how to live with COVID-19, a pandemic that has caused all of us to stop everything abruptly. Working, shopping, or getting around, the COVID-19 crisis has fundamentally changed many things. The pandemic has affected the day-to-day life and is slowing down the economy. Over the past few months, we have experienced an unprecedented shift in our life due to COVID-19. So before we could begin today's webinar, I call upon Mrs. Anju NC, lecturer, to accord the words of welcome. Anju, please.
Yeah, thank you, sir. A warm good morning to everyone present here. I am Mrs. Anju NC, lecturer, Lourde College of Nursing. Highly privileged to take this opportunity to welcome each one of you on behalf of Lourde College of Nursing to this webinar on how to live with COVID-19. I firstly welcome our beloved chairman, Dr. KJ Devasya, Lourde Group of Institution in his absentia. I welcome Dr. Joseph Benavan, Managing Director, Lourde Group of Institution in his absentia. I welcome our beloved Mrs. Rakhi Joseph, Director, Lourde Education Academy, for her continuous support. Otherwise, not possible to conduct this webinar like this. We welcome you, ma'am.
Thank you, Anju.
I highly honored to welcome our resource person on today's webinar, Dr. Jaffer Basheer, Senior Consultant Pulmonologist, Critical Care Medicine, Government Taluk Headquarters Hospital, Taliparamba. We welcome you, sir. I also welcome our principal, Professor Mr. Sendil Kumarji, who gave continuous support and guidance to conduct this webinar. We welcome you, sir. I also welcome our Vice Principal, Mr. Johnson LK, who gave great support to conduct this webinar. We welcome you, sir. I also welcome all dear colleagues, delegates, and students to this webinar. We welcome you all. Once again, I welcome you all to this webinar and have a great day. Thank you.
Thank you, Anju. A hearty welcome to you too. Here
Thank
I
you,
would like
sir.
to invite our director, Mrs. Rakhi Joseph, to give an opening remarks on today's webinar. Ma'am, please.
Good morning. Thank you, Johnson. Good morning, everyone. It is a great honor today. It is truly a great honor today to have Dr. Jaffer Basheer with us. I've heard great words about him from Dr. Benavan, our beloved managing director, who actually arranged this for us. So, Dr. Jaffer, we look forward to hearing from you. It is going to be a very, very important topic, dear delegates. So please pay attention. Please clarify your questions at the end of the session as well. Without further ado, let's go over to you. I welcome you once again to the Lourde Education family, Dr. Jaffer. Thank you.
Thank you. Thank you.
Thank you, ma'am. Despite the hopes surrounding a vaccine to halt the pandemic, World Health officials gave the world a reality check and suggested that the virus may never go away. He also added that viruses are not things we can fight. They are the things you learn to live with, treat, and mitigate. The medical community's top priority is remedy. People need to focus on living with and mitigating the risk of COVID-19. It simply means understanding that viruses are part of everyday life. We have such an eminent personality in the field of healthcare today here with us to give us a broad view on living with COVID-19. With immense pleasure and delight, let me introduce our resource person for the day, Dr. Jaffer Basheer. Doctor, the senior consultant in respiratory medicine at Government Taluk Headquarters Hospital, Thaliparamba since 2010. He holds the positions of the Nodal Officer, COVID Rapid Response Team, TB Officer, Taliparamba TB Unit, and Secretary, Kannur Chess Society. He has secured his MBBS from Government Medical College, Calicut, and PG from Institute of Chest Diseases, Government Medical College, Calicut. I am privileged to invite Dr. Jaffer Basheer to take up the session. Over to you, sir.
Okay. I hope the slides are visible.
Yes, sir, visible.
Okay. Is it in full screen?
Yes.
Okay. So thank you for the kind introduction, and thank you for the invitation to actually it's not presenting. I like to interact you with all of you on this topic. First of all, let me say that in case I ask questions or ask for comments in between, you can use the whoever hears me can use the chat box to give your comments. Okay. So a very good morning to all. As all of you know, and as the introductory speaker has told, all of our lives, no matter what we are, who we are, our lives have come upside down or topsy-turvy. But for us medical professionals, it's not actually upside down, it has become more intense. So one reason I like being in this webinar is that this is one rare instance when I can talk to so much people without wearing a mask. So the topic is living with COVID-19. It's a huge topic, big topic, wide topic. There's a lot of implications are there. But since I'm talking to medical professionals or paramedical staff, let's stick on with a few things. And also, considering the time I got to prepare in between all this hustle bustle and the time that we have to interact with each other, I'd like to divide the topic into three. Means the scientific part, some practical content, and some philosophy. So I think that will be concise, and I would like to be concise so that we can interact each other with after that. So okay, the second slide is visible, right?
Yeah, it is, sir. It is. Yeah, you can go ahead. Yeah.
First of all, I would like to put a disclaimer that means whatever I say, the scientific content, because I had to say this because over the last 6 months I've been taking training classes, and the content keeps changing. Even the WHO, the World Health Body, had to change opinions, had to take U-turns regarding information. So whatever I say now may change tomorrow. And another disclaimer is that some of the opinions that I say may be purely personal comments. Okay, so of the lot of things about the coronavirus, only two things are broadly there. Those things what we know and things what we do not know. So only two things we know is that the coronavirus is highly contagious, extremely infectious. Second thing, only a mask can protect us. So masks protect people from the contagious nature. So only these two things are definite. And whatever thousands of things are there in the sea of information are there, it's infinite, and most of them that we don't know. So this is primarily about the info, the scientific content, scientific things that we know about the coronavirus. So coming to the SARS-CoV-2. Actually, we should be bowing before this small guy. Some people call COVID bro or COVID bye or whatever, because you know that we are going to Mars soon. We are going to establish colonies on the moon soon. We are sending Hubble telescopes outside our Milky Way, but still the whole world is shut down by one single microscopic creature, and that's SARS-CoV-2. So that's the potential of this guy. And just for the info, so whatever the first part of my talk will be some scientific content, because thing is that for us medical professionals to live with COVID, we should not be illiterate or should not lack information about this thing, because the common man may know more than us. So SARS-CoV-2, the name, even kids have started saying, when they say, see the rambutan fruit, kids have started saying like corona param, like that. Okay, so the name comes, the corona means radiating. Radiating means radiating like the sun. And or another meaning is crown. So from the specific structure, where there's a globe and spikes all around it, looks like a sun. That's how the name comes. And CoV-2, because in 2003 we had a SARS-CoV-1 virus, which went away without much harm, and this becomes the second virus, so it's called SARS-CoV-2. And SARS means severe acute respiratory distress syndrome, because obviously it causes respiratory distress, very easily spreads from person to person, and little if any immunity. What that statement means is that that's exactly why it is so lethal, because you know that when we get chickenpox or measles or rubella, our body becomes immune to an extent. But for this guy, there is absolutely or very little immunity. That's why we are. Some noise.
Dr. Aruna KM, please mute yourself.
Okay, so that's why it becomes so lethal, and that's exactly why people are running behind vaccines. Okay. So the definition as such, it's a multi-system disease with thromboinflammation. Every point in this slide is important because that is the pure scientific content or pure scientific information about the COVID. It's mainly involving lung and vasculature, causes imbibed oxygen diffusion capacity in the lungs. It has varying systemic effect because it doesn't stick onto the lungs. It has implications from the head to toe, and it causes dysregulation of renin-angiotensin axis, causing variable hypertension, hypotension, etc. So this is the basic scientific pathophysiology of COVID. It's a multi-system disease. That means it doesn't stick to some lung or some single organ, which causes thromboinflammation. That's why we have a lot of post-COVID symptoms. And statistics, usually in the earlier talks, I used to give a lot of statistics. Now it has come so much that even discussing statistics of Thaliparamba, it will be enough to be for a huge sum. So we have crossed 1 lakh in deaths, COVID deaths. In fact, yesterday we had 50 deaths in Kerala alone. We had 5 deaths in Taliparamba region alone. So that is the things, how things are turning bad. This is a few days back. Now it's far higher. And, you know, there are a lot of, this is after the ICMR survey, means the huge bulk of the deaths or the cases are still undiagnosed or probably not tested. So this is one slide which can give the whole progression of the disease. This slide would be actually one of the beautiful slides in recent times, because when the person gets infected, 50% will have absolutely no symptoms. It will just go away in a few days. Maybe the virus will stick on the person for 1 or 2 weeks. And that's what makes it dangerous. These asymptomatic persons may infect others. The rest 50% will have few symptoms with cough, sore throat, fever, body pain, anosmia, loss of smell, loss of taste, etc. But 80% of these will recover in 10 to 14 days from the first symptoms, with mild symptoms. And these persons may require just home care. The rest 20% of this 50% may have to get hospitalized because the symptoms worsen. And of these, 85% will recover within 1 or 2 weeks during hospital stay without much complications. But 15% of them will go in for complications and may end up in the critical care unit, that's the ICU. And from there, 35 to 50, maybe even a little more, will recover with the intensive care support of the ICU nurses and doctors. But sadly, 50% of the rest 50% will die. And that's why it's lethal. So this is in short about the progression of the disease. In this slide, because every medical professionals have to know the progression of the disease, and we are bound to educate others. The symptoms we all know: fever, cough, shortness of breath, The other symptoms: sore throat, runny nose, body aches, headaches, chills, fatigue. Actually, a lot of patients are now coming up with intense fatigue. And another subset are coming with diarrhea and nausea, etc. And now, over the past 3 weeks, probably, many patients are coming with loss of smell and taste. And anosmia, or loss of smell, is thought to be a characteristic symptom of COVID. And severe, when it gets severe, the patient have to be hospitalized or put into the ICU. Then there is difficulty in breathing, when there is hypoxia, when there is fall in oxygen saturation, and there is severe chest pain. Means hypoxia may cause confusions and cyanosis. And who is a COVID patient? A confirmed case of a person is called COVID, a COVID patient when is confirmed with a laboratory confirmed cases test like antigen or RT-PCR or whatever. When there is, these persons require special attention. Those with heart disease, those with lung disease, those with diabetes, and those with suppressed immune symptoms. We'll have a short discussion on that later as the presentation progresses. And how much does it survive outside the body? That's one mysterious thing, because we say that Ishwaran Thunilum Thurimbilundam. But this guy is seen to stick on to everything. And it's very difficult to say how many hours. In some surfaces sticks on for hours, and whereas some like in cardboards, plastic, it sticks for maybe days. So that's why we need to sanitize, we need to wash our hands, and we need to keep our hands clean and avoid unnecessary. Hello. Okay. Okay. Now the seasonal flu versus COVID flu. We every year during the monsoons we have flu all over the world. And for us, Kerala, that's what called seasonal flu. But the thing is that this is very much spreads like the seasonal flu, but it spreads far more than the seasonal flu. Now, over the last 1 month, lot of households in Taliparamba. I'm speaking from Taliparamba, so what I can say is about our place. Lots of households from Thaliparamba. There are households with everyone infected, and finally, when someone gets bad, they turn up with the doctor. Otherwise, they'll just take home remedies and go on. Treatment and vaccines. We know all of us are actually eagerly waiting for a vaccine. To be frank, the majority of scientific community says or thinks that absolutely there's no point in waiting for a vaccine. And a vaccine may not be as beneficial as we earlier thought. And the better thing or the best thing would be an actual medicine or a treatable thing to come up. And as of now, there is no vaccine, and treatment is mainly supportive. So I think there's no need to discuss a lot of on treatment. But I would say a few of the medicines that we have. And we need to know that for us, the paramedical staff or the medical staff are the highest risk potential for exposure. And we must know that, because we shouldn't take our lives lightly, and we shouldn't take our working time lightly. So we are the higher risk. Then comes the laboratory people, then those people who are doing intensive invasive procedures, dental procedures, and even the cleaning staff of our hospitals are also at a very high risk. And the medium exposure, this is actually we should know, because if our relatives or our patients come from these occupations, we should have a higher risk index of suspicion of COVID if they turn up with fever. Then comes these guys. I mentioned these guys because these are people working at home in their cubicles or means at relaxation. But these people are more dangerous than the virus, because these people create and spread all sorts of fake and fraudulent information regarding various things, including COVID. Probably you will not know Avi Brikal Varam. when there's a message circulating that എല്ലാവരും ഒരാഴ്ച മുഴുവൻ ആവി പിടിച്ചാൽ കോവിഡിൽ നിന്ന് തുരത്താം. So these people are the persons who are creating this. And so what can we do? We should be informed and prepared. That's exactly what we are doing now. We should maintain social distancing. I may keep telling about this because this is the only proven thing which can keep us away from this COVID. Use sanitizers, avoid touching your eyes, nose, mouth. So we should be actually telling this thing again and again to ourselves. Every day we come to the hospital, we should tell ourselves that avoid touching your eyes, nose and mouth, etc. So and when we cough or sneeze, have a tissue with you, or use your elbow if you don't have a tissue. And frequently disinfect the touch objects and things that you take back to home. You have to disinfect them or sanitize them. Regarding testing, this is something which we have to know because you know that reading newspapers and social media, the common man is probably getting more educated than the medical professionals regarding various aspects. So just an overview of all the tests. The tests we have for COVID right now are the RAT, the rapid antigen test, RT-PCR, reverse transcriptase polymerase chain reaction, the TrueNAT test, CBNAT, and antibody. So antigen test, to put in simple words, means suppose we have a snake in a room, and if you see the snake or the head of the snake, that is the antigen test. That is the antigen test detects the snake or the virus particles as per se. So if antigen is positive, this is definitely positive. But the thing is that if antigen is negative, it doesn't mean that it is the person does not have COVID. He may have, or he or she may have. That is, there is a room in the snake, we may not be seeing it. So that is, it may have a false negative result. But this is the most commonly done test as of now. Probably the Lourde hospital is doing on COVID test for inpatients. And RT-PCR is the gold standard, which detects, suppose the snake has been there is some shreds of its skin or the smell of the snake. This RT-PCR detects that. The minute contents of the snake is being detected, or the COVID is detected, that is RT-PCR. The TrueNAT and CBNAT are the quicker variants or concise variants of RT-PCR. Antibody is that, suppose a person is in the room with a hand on his hand, with which he tried to kill the snake. And we know that if a person is standing there with a stick, we know that there was a snake. So if we have immunoglobulins, active immunoglobulins, that means IgM and IgG is there. If IgM is positive, the person has had a recent infection or is infective. And IgG positive means the person has been already infected and has a bit of immunity. And he may not get the disease. So I told that, I will not go in detail with the treatment. We have a plethora of medication. This also we have to know, because people may, our relatives or maybe our patients, a lot of people may ask us about this medicine. So these are the approved medicines per se in our country. Actually, there are more than 50 which I can describe. These are the major 10. Remdesivir, dexamethasone, favipiravir, lopinavir, ritonavir, tocilizumab, azithromycin, hydroxychloroquine, convalescent plasma, ivermectin, and doxycycline. Some of these are antibiotics, some of these are antivirals, some of these are immunomodulators. So these are in brief about the major medications available. If you have any doubts regarding that, you can ask during the discussions. Okay, so I'm putting this slide in frame because, as I told, we should be aware of the categorization of the disease. So this is actually in our Kerala context, because we have to know, because we have categorized that category A, B, and C so as to for the logistics, how the patient has to be treated. Category A patients are those with asymptomatic or mild symptoms, mild sore throat, cough, mild rhinitis, maybe some diarrhea. B patients are those with severe fever, severe throat out, cough, plus high risk, that is those have earlier lung, heart, kidney diseases, those with hypertension, those are immunosuppressive drugs like steroids, pregnant people, and those with age more than 60. These come under Category B. Category C are those are severely sick with severe breathlessness, chest pain, drowsiness, fallen BP, and also with children with ILI. You have to know the term ILI and SARI. ILI means influenza-like illness. SARI means severe acute respiratory illness. These are the two terms we have to know. So these are red flag signs. Those come under categories. So you have to know about category A and C. A, usually treated at home. Mild B, all these have mild, and B and C is further divided to mild, moderate, severe. Mild B can also be treated at home, but severe and C, category C, has to go to the hospital. And this is another thing, find the slide. I told that A, B, and C, how it is stratified. And we have to avoid NSAIDs. This and use only paracetamol unless absolutely necessary. This information I'm sharing because actually in my 15 years career, I found that the nursing staff have a lot of things to do. I recall many years back while taking rounds, a patient told about excessive fatigue. I couldn't find any specific thing that causes so much fatigue. The nurse with me, she told that, sir, sodium noki kude, hyponatremia kude. Only then did I think about that possibility of hyponatremia, and when I tested, it was low. So after that, this thing stayed with me for till now, and I never forgot it. So nursing staff has a lot to contribute during medical care, and all information they have, they should never be ashamed of be sharing with others or even asking the doctors. So you should avoid NSAIDs. And so if you see any doctor using NSAID, I think you should be courageous to ask. Avoid using nebulized drugs, especially this has a potential for aerosolization, and that may increase the risk of spread. So in our hospital, if there is no specific isolated station for nebulization, as far as possible, avoid it. Oseltamivir can be used in the initial stage till the results come. There is something called pneumonia. GINA Gold guidelines for asthma and COPD means inhaled steroids should be used. So let's forget about other things. Okay, the chemoprophylaxis. You know, we are all medical professionals, and we should be taking chemoprophylaxis. And the ICMR, the Indian Council of Medical Research, has advised hydroxychloroquine as the only approved chemoprophylaxis as for now. And probably ivermectin may also come as a prophylactic drug soon. Okay, I think we all know about this thing, prophylaxis. The initially 400 milligram twice daily on day 1, then followed by weekly dose of 400 milligram once daily. Okay, now coming to the post-COVID complications. So just ending the scientific content, because now we have started experiencing a lot of people with post-COVID complications, because we are now almost in the 6th month or probably 8th month since the COVID has actually 8th month actually. And by December, we'll be celebrating this COVID bro's birthday. And the complications are basically the lung-related complications, the coagulopathy-related, and the mental related. So the lung-related complications, I will be discussing a few of the cases in which we have to give special attention. Means stroke. The coagulopathy, a lot of patients are coming with post-COVID stroke or vascular complications. So you have to be attentive of that. If you see patients in your hospital or in your relatives or whoever you know, you can ask them to get checked, because very recently, 2 weeks back, a homeo doctor died who was practicing in Taliparamba area due to a sudden stroke or cardiovascular event. So it is these slides are actually from the Australian board, So the basic thing we have to say, all the patients with an earlier cardiovascular disease and old CVA is to take the prescribed medications regularly. If any small issues, to ask, at least have a telephonic consultation with their doctor. Ask them to be active physically and mentally. Do not stop medications. And if any symptoms, early signs of worsening of neurological symptoms, they have to seek medical attention. Those who are cardiovascular, same thing, same messages. But if specific warning signs, chest pain or increased breathlessness, they have to seek immediate medical attention. Diabetics, actually India is the diabetic capital of the world, and Kerala is the diabetic capital of India. So in another words, Kerala is the diabetic capital of the world. We have so much diabetics, so much vulnerable population. That is why we are fearing this disease more than anybody else. And luckily, so far, we have been able to contain the deaths, but we never know what will happen tomorrow. So ask the diabetic patients to have strict glycemic control, not to avoid their medications. And if any symptoms, BP fall, hypoglycemia, COVID has per se has the potential to cause hyperglycemia. Asthma is my personally, I'm a pulmonologist. So asthmatic, you know that the disease mainly affects the lungs. So asthmatics, COPD patients, maybe some of us who, the persons who are hearing me will be asthmatics. So we should not stop our medication, because our lung health is actually earlier impaired. We should use our inhalers. And if any worsening of breathlessness, we have to consult our doctor. We should not have any delay. Arthritis per se is not a risk. Actually, I put arthritis because these are patients who are taking immunosuppressive drugs. And arthritis patients are on long-term steroids. So they should have, they are at high risk of developing COVID as well as having complications. So this group of people, which I told, come under, I just put the slides to have a mental picture. So to have specific attention to your patients, to your relatives, and whoever, these subset of people deserve special attention. So I'm, as earlier told, I'm putting this message again: wash your hands regularly, always wear a mask while you go outside. Higher vulnerable people, actually reverse quarantine is the only practically possible solution or prevention that we can have. There's no point in lockdowns anymore. Reverse quarantine means the susceptible population should sit in their homes. That is the only possible thing that we can do. Now coming to so that was the scientific part. Now the second part is the practical aspect, what we have to do. These three things, every one of us, each and every one of us should pay attention. Our nutrition, our hydration, and exercise. And you know that most of us, means we even don't have a good breakfast before coming to the hospital or coming to the college. So the breakfast is the most important diet of the day. And we should have a balanced nutrition, because if the nutrition is low, our immunity is low, when the immunity is low, we have a higher chance of getting infected. And moreover, we are at a higher risk of having complications. Hydration, I'll discuss it later on. So nutrition advice that we should have is that we have to eat fresh and unprocessed food every day. Eat a lot of fruits, lot of vegetables, legumes, protein-rich diet, and avoid unprocessed or fast food, and eat moderate amounts of fat and oil that keeps our physical strength strong, and try to avoid processed meat because they are high content of salt, and eat less salt and sugar. That is one important point we have to notice while during our nutrition. Don't avoid salt and sugar as far as possible. Drink water every day and avoid eating out. We know that we may enjoy eating out, but we'll probably come back with the virus. So we have to eat vitamin C rich plant-based foods, the amla, oranges, papaya, capsicum, guava, whatever, all these things. But having said that, there's a saying in Malayalam, adhigamayal amrutam visham, and actually it's exactly what's happening. It means a lot of people lemon juice 4 നേരൊക്കെ കഴിച്ചിട്ട് acidity കൂടി chest pain ആയിട്ട് എൻ്റെ അടുത്ത് വന്ന കേസ് ഇഷ്ടം പോലെ ഉണ്ട്. There are a lot of gastros were saying, my friend gastroenterologists were saying that lot of people എന്താ പറയുക ഇഞ്ചി ജ്യൂസും വേറെ വാട്സാപ്പിൽ കണ്ട സകലമാന ഹോം റെമഡി അടിച്ച് കഴിച്ചിട്ട് സിവിയർ ഗാസ്ട്രൈറ്റിസ് സിവിയർ ഡയറിയ ഒക്കെ ആയിട്ട് വരുന്ന ഇഷ്ടം പോലെ ഉണ്ട്. സോ തിങ് ഈസ് ദാറ്റ് it should be eaten in a balanced way, but these things ensure that these things are in your diet every day. Amla, oranges, papaya, and all those plant-based with vitamin C rich fruits and vegetables. And iron rich, that is another important thing for our immunity, our cell-based immunity. Lot of proteins, lot of leafy vegetables, and fortified nuts, means dry fruits, etc. we should be ensuring in our diet. And those who are working in the kitchen, you know that means the food that the vegetables, the fruits we have buy from the market, always there is a possibility of carrying the virus. So always wash your fruits, and so it's not the point of eating a lot of fruits. We have to be clean them so that the fruits as such don't give us the virus. So wash the fruits with a good solution. Some use salt water, some use soap water. Cook your meat well. That's very important because animals have the potential to carry the virus. Stay hydrated, of course. Avoid sharing food utensils. So in your hostel, your workplace, even in your homes, use your own plates, use your own glasses, and avoid sharing them. Always clean the surfaces, our kitchen tables or dining tables, our whatever the place of work. Avoid use surface disinfectants or sanitizing sprays. And okay, that's the practical things which I have to say. Okay, again, stay hydrated. That is very, very, very important because it has special attention, because using mask actually increases the dehydration. Our dehydration increases when we continually use mask. So my advice, the WHO says to drink 8 to 10 cups of water every day. Of course, water is the best choice, nothing less, nothing more. But I would say 12 to 15 glasses, considering the humidity in our part of the world. Also, you can use fruits, vegetable juices, other drinks, lemon juice, etc., etc. But try to avoid too much caffeine, too much fizzy drinks like that with carbonated drinks. Try to avoid. Okay, exercise. Obviously, exercise keeps us active in body and mind. So when you're sitting at home, use online exercise classes. Lot of things are available in the YouTube. You know, people end up with the orthopedician with trying extreme exercises and breaking their bones. Jumping rope exercises are good. Dancing obviously keeps our mind and body active. You've seen nurses and doctors dancing in their PPE kits. And strengthening, muscle strengthening is very important. And playing active video games, I wouldn't encourage much, but maybe will give us a break from the boredom. Sleep well, very, very, very important. Most of us, students, adults, kids alike, they are too much endorsed in the social media or whatever, and we don't have enough sleep. And for COVID, sleep has a very important position because you know something called cytokine storm. Cytokine storm is the deadly complication of the COVID. And people who don't sleep well enough, are studies say that they are more prone to get a cytokine storm. Because if you read about cytokines, there is a balance, cytokine, interleukin, all those balance happening during sleep. And decreased sleep, increased chance of getting a cytokine storm. So you should have 7 to 8 hours good continuous sleep every day. Make it a point to have a good sleep every day. Sleep early and wake up early. And coming to the mental aspects, you know that what are the three things we have as humans? The body, the mind. Some will stop with that, body and mind. Actually, I would say the third thing will be a soul. So the body and mind, it's not, the health should be not only be to the body, the mind should be healthy too, because we are all as medical, even I have been to depressed states during these pandemic times, and I had to bring myself up. So it is normal to feel sad, stressed, confused, scared, but you have to use your friends, family, contact your friends and family. When you are staying at home, have a healthy lifestyle, and never ever go in for smoking, alcohol, and all those abuses which will spoil our health and life altogether. And never go in for fake messages. Have entertainments, not means only academics. You have to have entertainments of your own. You sing, you dance, you see comedies, a lot of things, and use your skills, because probably the highest YouTube channels came up in here, the history of YouTube during these lockdown periods. It is very normal to feel fearful and anxious. These things, some may not agree during this point of period. Probably in the next coming months, you will all feel this. So it's normal to feel anxious, but you have to talk with your buddies, friends, family, colleagues, supervisors, seniors, anybody. So as healthcare workers, when you are in the field, you have to, there may be extremely, I can say that during June, while I was working in COVID hospital, Anjarakandi, myself and the nurse had a 4 hours rounds, seeing about 95 odd COVID positive patients. And just after finishing the rounds, the sister just went away. Then I heard a thud sound. She just collapsed, means because of the exhaustion. So we'll all be exhausted. So if you are exhausted, you have to detach yourself for some time, talk to your supervisor, and get enough physical and mental rest. And always, it's normal, again, I'm keep telling this, always talk your feeling with somebody. Never keep it on yourself. You know the incident of Sushant Singh Rajput. There are a lot of cases of doctors or paramedical staff committing suicide during these pandemic periods. So always vent out your feelings, share your feelings. And this is very important. Don't constantly listen to the media coverage. In fact, our state, we are lucky that our CM, Chief Minister, keeps giving updates every 6 o'clock, every day at 6 o'clock. But actually, personally, I would feel that better that will be a weekly update would be fine, because it keeps making people anxious, create panic. But and for us also, there is a habit of constantly checking the count, etc. But limit your time while checking the COVID statistics, and listen to something else. In fact, over the past 2 months, I've been getting patients, means being a chest physician, people come with psychogenic dyspnea, like this young chaps or young girls. ശ്വാസം കിട്ടുന്നില്ല ഡോക്ടറെ, ശ്വാസം വിട്ടിട്ട് അരമണിക്കൂർ കഴിഞ്ഞിട്ട് പുറത്തു വിടാൻ പറ്റുന്നുള്ളൂ, അല്ലെങ്കിൽ ശ്വാസം ഉള്ളിലേക്ക് പോകുന്നു, പുറത്തേക്ക് പോകുന്നില്ല, ഇങ്ങനെയൊക്കെ they say. And obviously it's psychogenic dyspnea. And the first thing I'll tell them is that stop seeing TV and use your social media only for entertainment. Don't see any panic creating messages. So that's actually happening in the younger population. So again, same thing, the sudden constant stream of news reports, fake information. So get your facts right. A lot of, as I told earlier, people accept fake treatments, fake remedies more than scientific remedies, and finally they end up with some other illness like gastritis and diarrhea, etc. Now, so that was the practical part as medical professionals. Now coming to some philosophy, I don't know whether all of you may agree with this, but these are personal views and I found them very inspiring. And I would just share it with them. What 12 life lessons which COVID has taught us. 1, it is reminding us that we are all equal, regardless of our culture, religion, occupation, financial status, or how famous we are. Because you know that the most protected person on earth, the US president has contracted it. The person with the highest Z plus security in India. The Home Minister, he has got COVID. So it doesn't means discriminate anybody. So this is one lesson that we have learned. We are all equal. Regardless, means people are fighting over religion, over caste, over culture. But to be frank, COVID has taught us that we are all equal. It is reminding us that we are all connected. And something which affects one person will have an effect on another. You know that, just for one example, recently one patient came to me. Earlier he used to be very good, well dressed. This time when he came, he was very shabby dressed. I asked what happened. He told me that, "Sare, ഈ ലോക്ക്ഡൌണിന് മുമ്പ് പണി ഒഴിഞ്ഞ സമയമില്ലായിരുന്നു, പിന്നെ ഭയങ്കര വരുമാനമൊക്കെ ഉഷാറായിരുന്നു. He is actually a പന്തൽ worker. He worked marriage functionsനും മറ്റ് ഫംഗ്ഷൻസിനൊക്കെ പന്തൽ ഉണ്ടാക്കുന്ന ആളായിരുന്നു. But now he was a rich man. Now he ended up becoming poor because he has no work." അപ്പോൾ ഒരാൾ മാരേജ് ഇല്ലെങ്കിൽ, the lot of people who are connected, the pandal workers, the sound system workers, the people who cook, so everything is connected. So COVID has shown us that we are all connected in one way or another. This is just a small example. There are a lot of examples more. COVID reminds us that the false borders that we have put up have little values. COVID in passport illa. You know that actually COVID virus has shut down the world more than the World War I and II without firing a single bomb. ഒരു ബോംബ്, ഒരു എക്സ്പ്ലോഷൻ പോലും ഇല്ല. The whole world was shut down by this guy. And irrespective, I think almost every country in the world has been affected with COVID at least some part of the time. And we are fighting on geographical barriers. You know, in India, Pakistan, China, we have geographical issues. But COVID has taught us that all these physical borders are actually nothing. The next lesson, as COVID has taught us, that the shortness of life, about what it is most important for us to do. Actually, നമ്മുടെ ഈ ചെറിയ ജീവിതത്തിൽ maybe some 40, 50, 60, 70, 80, whatever, even if you live till 100, it is actually very short. And the best thing we can do is that to help each other. Parasparam sahayika, that's what we are supposed to do. Now, COVID has also taught that the materialistic society, you know, we were running about. That is one thing. My wife used to say that എല്ലാവരും ഓടുകയായിരുന്നു, പാഞ്ഞ് തിരക്ക്. COVID has put brakes on that. And we have started remembering that the basic things that we need is food, water, and medicine. During the lockdown period, there were very rich businessmen who was standing in the community kitchen queue to have some food. You know, I witnessed that. So it's not luxuries in life, it's basic needs, food, water, and medicine that humans require. And COVID has taught that lesson to us. And also the family. Means people have started, means brothers, sisters, siblings have started talking. You know, parents and children have started communicating. Actually, my son was telling that I got my father at home maximum during COVID times, and that's why I liked the coronavirus. He was actually telling it 2 months back. And it also, COVID is reminding that our true work is not our job. That is what we do, not what we were created to do. We have a lot of work. We have to look after each other, to protect each other, and to be benefit to one another. നമ്മളൊരു നേഴ്സ്, നമ്മളൊരു ഡോക്ടർ, നമ്മളൊരു കാർപ്പൻറ്റർ, ഒരു ഇലക്ട്രീഷ്യൻ, അങ്ങനെയുള്ളതിനേക്കാൾ ആക്ച്വലി we are destined to help each other. We are destined to protect each other. We are destined to benefit each other. So that thought has brought us, that ആ ഒരു ചിന്ത പല ആളുകളിലേക്കും തിരിച്ചു വന്നത്, it was due to COVID. Now, our egos, അത് പറയേണ്ട ആവശ്യമില്ല, നമ്മളെ ഈഗോസ് ഒക്കെ മാറി. Everywhere, എല്ലാവരും they started thinking, നമ്മളൊക്കെ അഹങ്കാരികളായിരുന്നു, we need to be more humble. So that is one lesson which COVID has taught us. And also, it is difficulties that bring out our true colors. These lockdown period has നമുക്കെല്ലാം പേഴ്സണൽ എക്സ്പീരിയൻസ് ഉണ്ടാവും. I have experiences, my relatives have, all of you must have experiences how many true colors of people have come out during the COVID times. And it is reminding that we can be patient, we can panic. Randu sambhavikam. That earlier ഞാൻ പറഞ്ഞല്ലോ. Anything means നമ്മൾ ക്ഷമിച്ച് സഹിച്ച് നിന്നവരുണ്ട്, and there are people who have panicked a lot. രണ്ടും സംഭവിക്കാം. And most of all, we have learned that the earth is sick. Actually, the earth was crying. And during the lockdown period, actually, the earth had a vacation after a long period of time. The nature was clean, the air was clean, the birds were chirping, singing, and animals were happy. So that is, we have learned to respect nature too. And it's reminding us that every difficulty there is always ease. Life is cyclical. You know, life is cyclical, history is cyclical, it keeps repeating itself. And you know, just learning the history of the Spanish flu will give us a lot of insights about the history repeating itself. So to motivate you individually, I know it's, the time is almost over. We should look in our mirror and say that all the power is within you. You can do anything. You know, we are struggling, everyone, financially, socially, lot of things, psychologically, in our relationship. We have to look in the mirror every day that never say no, never say I cannot, because we are infinite. Every power is within us and we can do anything. And it's always, we are always trying to act normal, live normal, but actually we have to think out of the box. We have to do out of the box. Only then we will realize how amazing we can be. And there are crybabies, you know, duranda kathapatranga. So if we keep on crying, and if you cry because the sun has gone out in our life, the tears will prevent us from seeing the stars. There are a lot of rays in the horizon, lot of stars shining, which we don't see. And no matter how much falls on us, we should keep plowing ahead. Only way to keep the roads clear. നമ്മൾ മുന്നോട്ട് തന്നെ പോവാ. നമ്മളെ മുന്നിൽ ഓബ്സ്റ്റിക്കിൾസ്, നമ്മളെ ദുരിതങ്ങൾ, സങ്കടങ്ങൾ, ഇതൊക്കെ ഉണ്ടാകുമ്പം ഷുഡ് നോട്ട് കീപ് stop us from moving forward. And we must be willing to let go of the life we plan. നമ്മളൊക്കെ ഒരുപാട് പ്ലാൻസ് ഉണ്ട് ജീവിതത്തിൽ, അത് ചെയ്യണം, ഇത് ചെയ്യണം, പക്ഷെ നമ്മളെ പ്ലാൻസ് ഒക്കെ മാറി. പക്ഷേ you should understand that there is a big life waiting ahead of us, and not just because the Almighty has planned something different, and we should accept that plan. So coming back, I'm keep repeating this. Keep connected with your family, with your friends, whoever it is who feel good to talk. Use your phones, use video chats, have Zoom meetings, and make yourself comfortable in your homes. Don't stress yourself. Do exercise, do yoga, do relaxing exercise, and avoid unhealthy behavior. That's something which happens with the professional always. You know, quite a lot of doctors who ended up drinking and having abuses because of the stress they have. And always be optimistic and keep looking forward. Having said that, I would like to scare you with this picture also. This is the actual picture from various ICUs, COVID ICUs. And I hope and pray that we never, and none of us end up like this, or none of us see patients ending up like this. But we have to know that this is the grim, the horror picture that COVID can offer you. And so we have to stay protected. We have to protect our vulnerables, our loved ones from ending up like this. So we have to break the chain. And this is probably, you know, it's the time of the Nobel Prizes. And I feel that if Nobel Prize was given to some single caption, this caption, break the chain, is the best thing that had happened in Kerala so far. But maybe we are a bit out of the track now, and I'm sure we'll come back. I'm just putting these names because if you are searching the social media, Dr. Arvind is the best person. There's a lot of expertise available. I use resources from Dr. Arvind, who is the head of infectious control in Trivandrum Medical College. He is the best person with COVID treatment. Professor Prathavidi is the best in ICU care. He's from Ernakulam Government Medical College. Rajiv Jaydevan is the best researcher in regarding COVID. And Info Clinic, those who have FP pages, I would request, I'm being a member of the Info Clinic, to like the Info Clinic page for a lot of authentic medical information in simple languages. So, thank you. Thank you for your patient hearing. And I would like to take clarifications, comments, and few questions too. Thank you.
Thank you, Doctor. Thanks for your valuable sessions. And dear participants, if you have any queries can be put in the chat box. Doctor, we have one question here. Nowadays, the homeo medicines are distributed through the Panchayat people. And can you clarify about that once? There is no instructions given to the general public. Just they are giving homeo medicines, and you have to take 4 medicines in empty stomach in the early morning.
See, actually, you know, I'm an allopathy modern medicine doctor, but I don't hate anybody, whoever it is. I tell my patients, നിങ്ങൾ ഹോമിയോ മരുന്ന് കഴിച്ചോളൂ, നിങ്ങൾ ആയുർവേദ മരുന്ന് കഴിച്ചോളൂ, പക്ഷേ it should bring out results. And you know, we are practicing scientific medicine. In India, the highest number of homeo medicines were distributed in Gujarat. But till now, the highest mortality also happened to be in Gujarat. The most persons die per 100 people. The fatality rate was highest in Gujarat. So it is something which had no scientific basis, no proven efficacy. So I wouldn't comment more on that.
Doctor, this is Senthil Kumar, principal again. I spoke to you last during your session with the Lourde Hospital also. So I'm taking again lead to ask some questions from my end. So as above all webinar today, as you guys, for all my students, we have a great consultant with us, Dr. Jaffer, as a pulmonologist. It's a great time, nice time to have a direct discussion with him. Please kindly utilize the opportunity. From my side, like I would like to have a great feeling that like Dr. Jaffer is not only a pulmonologist, but he is a great philosopher. And I do agree and admit all your philosophies, because it's not being you brought
bore you with the philosophies.
It's not like you are bringing not only the scientific evidences for the treatment or to tackle the COVID-19, but also you brought a lot of psychosocial information to all the attendees over here. From my end, like I have asked few more questions during my last session, but this time I want to ask 2 more questions from my side as well. As I read one of the Lancet journal's information on a couple of days ago, though we thought every one of us COVID-19 is mostly an respiratory related and it immediately affects the respiratory system. But the recent research by the neuro people or the neuro team, they found that like the initial attack by the COVID-19 is to the nervous system first. That's what like I read from the journal. And like this is that is the reason why like most of 78% of the clients have a kind of loss of taste and smell, and probably the affects the olfactory, glossopharyngeal and facial nerves of the central nervous system. I'm sure that you do agree with the same, like then later on only they will get like a kind of the rest of the symptoms keep coming up. Is it true so, doctor? Like it's
actually regarding COVID, actually we are somewhere like being in the 19th century when lot of diseases like tuberculosis, nobody knew what it was. People somewhere saying it was a evil curse, somewhere saying it was a demon. And finally, Robert Koch proved that it was a mycobacterium tuberculosis. So actually, we have the same situation now. This guy, the COVID guy, the coronavirus. Actually, people don't know. Means researchers are still wondering what it is, who it is, how it is. So the initial consensus was that it was primarily a respiratory virus, or primarily. But whatever we said, what you said is right. There is a subset of researchers who are in neurological research, but the primarily portal of entry is the lung. As
Okay.
as of any or microorganism, the primary portal of entry is through
yes, through
the lung,
okay.
and some of the virus or large bulk damages the lung, whereas just exactly like TB, you know, there is 85% is pulmonary TB, 15% is extrapulmonary TB. You can have neurotuberculosis, you can have spinal
Yes.
tuberculosis, you can have renal tuberculosis. In those cases also, the lung was the primary portal for entry, but it didn't stay in the lung or didn't cause any damage there, went into the kidney or went into the spine and causes disease there. So that's actually the answer to that. So I'll compare it to TB.
Yeah, I got it rightly, sir. And the next question is like you mentioned about the cytokinin storm. And you mentioned the sleep is the one of the predominant factor for contributing to make the patient to land up with cytokine storm. Is there is any other risk factors or related factors which may contribute for the cytokine storm?
Obesity is a risk factor. Obesity per se, you know, of the 600 something medical professionals, including doctors and nurses who have died, 50 to 60% of them were obese. So obesity is an independent risk factor. Obesity, it is an inflammatory condition. Actually, you heard about syndrome X, syndrome Z, etc. And another thing is diabetes. Also, diabetics are also more prone for cytokine storms.
Oh, that's great. Okay, like if that is the, even I read in the news as well around, especially the doctors from West Bengal, they are most of the doctors who has been sacrificed their life, that mostly comes from West Bengal. West Bengal. That's the reason I have heard about this also, sir. And is there is any relationship of this mortality in connection with the viral load? And how could you able to differentiate between this viral load? Like, is the viral load is the contributing factor for the land up in complications like that?
Yes, obviously, because again, of the deaths so far, of doctors and healthcare professionals, the majority of them are primary care physicians, primary care nurses first. The second group are those surgeons and ICU nurses. So the first subset are people who are the first, rather, if a person comes with fever, cough, or the high viral load, the day 0, day 1 of the infection has the highest viral load. So these persons are seen by the primary care physicians, and actually they get the highest viral load. So the mortality was obviously high in them. The primary care nurses who test the temperature or who give injections, they also got the higher viral load. The second subset who are in the ICU, the operation theaters, obviously closed spaces, which also magnify the viral load. And a lot of orthopedic surgeons, neurosurgeons have died due to COVID. So obviously, the higher the viral load, the higher the damage, the higher the risk of complications.
Oh, that's great. Thank you, doctor. And my dear students, most of them are here. All my students, around 350 students from our Lourde Education Academy, including Lourde College of Nursing. And you know, students have heard about the version from Dr. Jaffer Basheer. And like, please be careful. We are living a different life, not like before. I usually see even the students now, when they come 1 or 2, 3, 4 inside the campus, they are just mingling as like before. They never ever still bother about the social distancing and about conscious about wearing mask at all times, and they're just going as like before once they come into the campus or something like that, even come to the hostel.
I'll put in a comment on that, because
Yeah,
there's a study from the infectivity of healthcare workers in Kerala. When the study was done, almost all of them were well protected. They wore masks, they wore face shields, the PP kit, donning, doffing, everything was fine. But almost 80% of them contracted while having tea, while chatting, while having lunch, or socializing. So that was the statistics. So obviously that it's a very important point.
Yeah, that's true. That's what, like, we are in a different life. So please be mindful at least for some time again, when you are again coming for examination or visiting to the campus, or you are in the home or you are visiting to some social places. please be always put yourself into your mind about social distancing and wearing a mask. That is an utmost important that would be able to prevent the infection maximum possible way. Also, from my readings, I understand that better not to meet in the closed circuit as maximum as possible. Even now, I would see the televisions like in European countries, even most of the higher official meetings are happening outside the home, in the ground or in the park. They are even high-level meetings are going on outside. So I'm sure that such a kind of simple steps from our end definitely bring down the number of cases, and especially in Kerala. I'm sure that we are going to have a better days ahead in front of us. And thank you, Doctor, from my end for sharing a lot of new information to us. Thank you. Please, the session is open up. Please ask questions and get clarified from Doctor, please.
Doctor, there is another question sent through the WhatsApp. Please, delegates, you can put the questions in the chat box, and have received questions in the WhatsApp. There is a lot of myth among the COVID-19, and what is exactly the fact? So that's a question. But actually, the doctor explained through the three major headings: scientific, practical, and philosophy. Through this, the doctor explained clearly. Again, they have put the same question. What is that the myth around related to the COVID-19?
Actually, if we start discussing myths, we can have 1 more or 2 more hours on that. But I would say that you just Google COVID myths WHO. These are the keywords. And WHO website has published a lot of myths and its clarifications in detail. So I think you can have it in your personal free time. You can read about it. But lot of myths are there. Lot of myths. So I think it wouldn't be worth discussing it now. Lot of myths. So believe scientific content. Believe some things, even insane things, people start believing. Avi Medical Varam. People, very educated people had called me up. I just laughed, nothing more. I didn't bother clarifying them. About you just check up with just these sites, WHO COVID myths. That would be enough. That would be the answer.
Then one more question, Doctor. That is exactly what is the incubation period? Incubation period for the COVID-19.
Incubation period. I told that the virus is still mysterious. 2 to 14 days is the incubation period that has been postulated, and in majority of cases that has been found to be true. But there have been cases where the person was infected from a contact after 3 weeks. That is 21 days or about 28 days. So roughly the period is 2 to 14 days, the incubation period, and the highest infectivity was during the initial few days when there was the highest viral load.
Thank you, Doctor.
Doctor, one more question from my end. How would we differentiate from the common cold to COVID-19 symptoms?
Yeah, that's what I had put up a slide with seasonal flu versus COVID. So seasonal flu, in fact, is the common cold. But common cold, is probably less intense and less infectious. If in our household, if a person comes and say, obviously that has to be COVID, because that's highly infectious. A COVID positive person is thought to infect at least 5 to 6 persons in close contact without protection. And the important, and another thing is that when they this common cold, probably they'll have just sniffles. That's all. But a person with the sniffles, with myalgia, with loose stools, with anosmia, means all of any of these.
All right. So like it is better to go for a reverse quarantine if such a person is suspected with common cold in even home also. That is what would you like to recommend, or?
No,
like
not actually. With some other subset.
Other subsets of symptoms. Okay. Including myalgia and the rest of the things. All right. Okay. Yeah. Okay, that's fine. Thank you.
Another thing, I'll just say an experience. The CDC president, that is the Central Disease Control Unit, the highest body in the US, he had told that the mask and face shield is as good as the vaccine. And he had told this, and it was widely acclaimed. The father of one of the doctors in our hospital, probably he was one person, he was the casualty among who was seeing hundreds of cases. And so obviously high risk of infection. The father got COVID positive, and naturally he thought that he was the person who gave it to his father, and he got tested. He was negative, COVID antigen negative, RT-PCR negative. And the father actually he had is a bank employee. So thing is that this doctor, he always wore mask, always wore face shield. He was protected even in spite of being exposed to hundreds of potential COVID patients. The father who just went to the bank, maybe naturally the cloth mask probably may remove the mask frequently. He got it. So thing is that a proper only worn mask and face shield will obviously protect you.
Thank you.
Okay.
Dr. Jaffer, hi, this is Raki. First
Hi.
of all, thank you very, very much for such an informative session. I'm sure all the participants have definitely benefited out of this session, and you beautifully segregated the session into 3 phases, and that was wonderful. Thank you very much for that. Dr. Kavi undannu thonunu when we see the way you philosophically done it. Was beautiful. I have one question as a pure layman, yeah, and that is, although we say that most of the time COVID gets into a secondary phase or a much serious phase with people of certain pre-existing medical conditions, we have also heard of situations both internationally and also in India where a youngster with absolutely no medical condition have gone into a fatal stage even within a span of a week or two. Could you please enlighten on why that happened, and did he do anything wrong to get there? Is there anything we can do for us to avoid such a situation? Thank you.
Thing is that I had a personal experience. My one good friend, Dr. Sanjeev Kumar from Bihar, he is 3 years younger to me. He unfortunately passed away last month. Means very young, healthy, no comorbidities. But the thing is that the young are the productive age group who go out. They are the economically active people, and naturally they are the persons who are most prone to get the highest vital. Just like the doctors I told, the primary care physicians get the highest viral load. Similarly, young persons who are active, who interact, who socialize, who meet more people than probably the other age groups, they get a higher viral load. So the higher the viral load, the higher the complications. So a very perfectly healthy person, if he gets a very high viral load, probably the virus will overcome his immunity and naturally kill him. That's what's happening. And we had on one excise officer, probably might read in the news, the first major young death, 28-year-old excise officer who died. And in Pariyaram, actually, we were discussing it with Pariyaram doctors. They didn't know what's happening. Means he got admitted, next day is on ventilator, he couldn't breathe. Means in that 24 hours, he had actually spoken on phone with his relatives. But worsened all of a sudden and went off. But actually, a lot of cases are coming. And we think that it's due to the higher viral load. Then second thing is that although we feel young people are healthy, actually my guru or my teacher, Professor P.K. Shashidharan, probably you will be hearing his videos and some news about him. Although I don't endorse him completely, many things he told about nutrition. Most of us young people lack a lot of nutrients, vitamin D, many vitamin B6, riboflavin, lot of things are lacking. If you ask the audience, 300 odd audience, how many of you regularly have fruits? Probably 50% of them won't be having. How many of you drink 10 glasses of water every day? Many of will not be doing that. So a balanced nutrition, good hydration, lot of vegetable and fruits. This is something that's why I put up that slide. This is something when we are living with COVID, these are things which will protect us. or we will end up with dying all of a sudden, getting sick all of a sudden for no reason. Okay.
Right. Thank you very much, Doctor. Just one more question connected to that. Like you quite rightly said, around 50 to 80% of us who are here as participants might be lacking in quite a number of vitamins and minerals. So we
Obviously.
talk about supplements. Do you think these supplements like Zinc-O-Vit or Lumpy can actually replace all those vitamins that we were supposed to accrue over the years and bring us back to a normal sort of a person within a short span?
Yeah, that's like our habits. You know, ഒരാള് എപ്പോഴും കള പറയുന്ന ആൾക്ക് ഒരു ദിവസം സുപ്രഭാതത്തിൽ he can become an honest person. Like that, our habits, our physical means nutrition is something which we gain over years. So if we lack something, we can't correct it all of a sudden, but it's better late than never. So if we start taking these supplements, have a balanced diet, it will gradually get corrected. So naturally, we can't expect the COVID to go away until 1 year, unless some miracle happen. So if we start taking the earlier, means I don't recommend tablets per se. I would tell a lot of citrus fruits, just like I mentioned, amla,
Right.
papaya, whatever. So, and other supplements, vitamin D3, actually our population is very much lacking in vitamin D3, and it has been postulated to have a lot of implications in many diseases. So the proper supplements, at least, vitamin C weekly or monthly supplements would be fine. So by time we will replenish our deficiencies.
Right. Okay. Thank you very much, Doctor. Thank you.
Okay.
Any
Doctor,
questions
one more
from
question.
student side? Encourage them to ask questions, please. Yeah, go ahead, Johnson, please.
Yeah, it's from the student side. What is the fact behind that the post-COVID patient has a chance for developing lung fibrosis and reduced lifespan?
That's a fact, because that's what we are all worried about. As a pulmonologist, I can't imagine the next 2 years. Already we are getting cases with decreased lung function. I'll relate an incident about a friend of a friend. Means she, 26-year-old PG resident doctor in Trivandrum. If I remember rightly, she was positive. She went in for home treatment. She recovered, became negative. But during home quarantine, she experienced severe dyspnea during washing and during her personal chores. And when a CT was taken, the bilateral lung fibrosis was there. And obviously, her future is bleak because unless she gets a lung transplant. So that's what's happening. But probably now some promising thing is that, or promising news is that, unlike other fibrotic lung diseases, this COVID-induced fibrosis is reversible. And actually, yesterday I participated in a talk regarding this particular topic. And the promising thing is that there are drugs coming up which can modify or repair the fibrosis, and that the fibrosis is not permanent. So obviously lung is damaged, and the other thing is the other side of like the Professor Sendil told, the neurological complications and the vascular complications are the other subset of deadly complications. Okay.
Johnson, do we have any more questions?
No, ma'am. That's all the questions.
Shall we conclude the session in that case?
Yes, ma'am. I think delegates, there is no more questions, and whatever the questions was asked, it is clarified with you. Hope you understand how you got the points. And if there is no more questions, we shall wind up the sessions. Thank you, Doctor, for your valuable sessions and clarifying the questions of the delegates. And now I invite Mrs. Nimi Augustine, Assistant Professor, to propose the vote of thanks.
Good afternoon, everyone. Our respected Chairman, Dr. K.J. Devasya, Managing Director, Dr. Joseph Benavin, in their absentia, and our beloved Director, Lourde Education Academy, Mrs. Ragi Joseph, uh, and most valued speaker of today, Dr. Jaffer Basheer, and our dear Principal, Vice Principal, dear delegates, colleagues, and my dear students. It's my privilege to have been asked to propose a vote of thanks on this occasion. I'm grateful to God Almighty for showering His abundant blessings on us today in conducting this webinar. And I'm deeply indebted to our chairman, Dr. K.J. Devasya, Managing Director, and Dr. Joseph Benavan, or Lourde Education Academy, for their constant inspiration and motivation. And we are really grateful to Dr. Jaffer Basheer, the resource person for this webinar. I must mention his zest and enthusiasm when he was invited for the same. And you made an outstanding coverage on the topic, sir. A bucket of thanks on behalf of Lourde College of Nursing.
Thank you. Thank you.
And I express my gratitude to our director, Mrs. Ragi Joseph. Thank you so much, ma'am, for your constant support and inspiration.
Oh, thank you, Nimi. Dr. Jaffer, really, from the bottom of our heart, we are truly indebted that you could find time to be with us today. Your session was not only informative, but we've all taken it to heart as well. So thank you very, very much. Thank you.
Thank you. Thank you.
I also wish to express my gratitude to our dear principal, Professor Senthil Kumar T, for the timely support and guidance for the event. Thank you, sir. And I'm also grateful to our vice principal, who was the moderator for the same, and I place on record a hearty thanks to you, sir. And I take this opportunity to thank all the organizing committee members for the enormous cooperation and the organization of the event. Thank you all once again. And I deeply appreciate the keenness and the interest of the delegates who attended this webinar from different regions. Thanking you all wholeheartedly. I know I cannot thank everyone enough for their involvement and willingness to take on the completion of the task beyond their comfort zones. Once again, I thank you all. Thank you.
Thank you once again, Dr. Jaffer, and we announce the session is concluded. Thank you.
Thank you.
Thank you, ma'am.